So rather than the belly dangling down towards the floor, we want it to be the gravity going down, okay? So the baby starts to come out, and as it gets to the widest point that's actually visible underneath, we call it crowning, okay? And that's the bit where they call it more as the sort of stinging sensation, where the skin is the most stretched. And that's when old-fashioned, we used to say pant, yeah? You know, you see the old-fashioned thing of, oh, should I pant? We don't tell women to do that anymore. I just keep them calm, just keep them breathing, and if they don't try and go and push, it would just, the next contraction would just literally bring the baby out. And the baby, when the mum's in this position, appears like this, look. If you can come from this side, the skin is round the baby's face like that, and literally the baby will just appear like this. And they often will stop going, like screwing their face up, but they're still inside. Their tummy's still inside. And again, sometimes this all happens in like one big push, or we can just leave the baby there. All right, it's not breathing because its ribs, everything is inside. It's only in this space, so the baby is very much contracted. Okay, and if you've got a water birth, you have this period of time where the baby's head is like this, and the baby might be going like that, looking around and pulling faces, and it doesn't breathe because it's still completely compressed. It's getting all its oxygen from the umbilical cord still, and then as it's suddenly then expelled in the next contraction, it will just come out, and you can just deliver onto the floor, or if I was hands-poised midwife, I would just be there to collect it sort of and drop it to the floor. Or the woman can deliver it herself as it comes, yeah, and the baby is born, so it comes out of it. Right. And then what mum can do is, if the baby's just on a cushion, on a pillow, you just sit back. There you are, and she'll pick her own,
not on the head,
her own baby up, and bring it to her chest. So it's still attached with the placenta, okay? And they can just be left attached. And the cord will pulsate for a minute or two, and that's fine, the baby will slowly pink up. If it isn't, if it's not pinking up or it's not breathing at this stage, we might take it away and we might cut the cord, because by cutting the cord, the baby then has to gasp and it encourages them to breathe. But in a gentle birth, if there's been no complications, the cord will carry on pulsating, the baby gets more red blood cells, so it's better for them, and the placenta can stay attached. Okay, this is our placenta, put it on its tummy, like that, okay, this is still up in there, alright, and then we would just get mum comfortable, she might lie back, and if the baby is then left to root, what's it naturally going to want to do? Yeah, so hopefully it will start looking at the boobs, flinging itself around the mum's chest. Whether or not it feeds or not, the fact that the baby is now on the mum's chest increases her what hormone? Oxytocin. And what does oxytocin do to the uterus?
Causes it to
contracts the uterus. So if the baby latches particularly on the nipple and it starts to suckle, the uterus is carrying on, this bag is getting smaller and smaller and smaller, and usually she does have to actually, she pushes it out, and that's everything. Oh my goodness, you have to push it out, but it's nothing, you know, like you've got the baby in your arms, you can feel the weight of it sort of sitting, and it's come away. We check to see it's come away. We just get little gush of blood, means it's no longer, and you can say just push, and we just say just push it out, and we collect it out, and out comes a sort of big piece of, a bit like liver. All right, and this is accurately about the size of this baby's placenta. Yeah, so it's like that, just a piece of liver, and it's delivered. If the mum wants to have the injection, or there's a reason we need to do that, like we're worried that she's going to bleed, or she's had a lot of deliveries, maybe if you've had a few deliveries, we sometimes recommend the injection, because the injection makes the uterus contract harder and faster. So as the baby comes out, I would give you the injection called syntometrin, and that makes the contractions be a bit more powerful. And then as soon as I see the gush of blood, what we do is, the midwives, is we take the cord and we sort of pull on it, and we remove it and plop it into like a kidney dish or something.